And what we're going to do with Joan here is we're going to have her down on the floor, and she's going to start to just pull one leg at a time up toward her chest. Now, she's had hip replacement surgery on both sides. There's going to be some limitations of movement due to that, and she's going to have, but you can see she has reasonable range of motion, and there's no limitations to that. Just have to be a little careful. Okay, so this is lengthening up the posterior part of the back. So now we're going to do the star across. So this is a rotational stretch. When you have injury in the sciatica area, it's the posterior of the leg, you want to lengthen out the accessory muscles, the lateral muscles, and so lengthen these out. Let's come back the other way. And she's able to stretch and lengthen out these areas in here. Okay? And so those are just simple things. And so cross a leg over the other, just like you're sitting at the table. Now we're going to stretch the lateral rotators. Now this exercise specifically, when you go through hip replacement surgery, they will tell, please do not rotate your leg out like this, because their concern is that it somehow can make the joint dislocate. Once you've gone through all the physical therapy and all of that, the joint has healed itself to where it's maintained. So there really aren't any limitation. We need to access those lateral muscles. So she has crossed her leg just like she would at the table, and then she lifts the leg up, and it lengthens out the rotator muscles along along the leg and the switch sides. And it'll lengthen out these rotator muscles in here. Okay. All right. Now, we've stretched out and lengthened the accessory muscles, and we want to activate the gluteal muscles, so we're going to do a bridge, okay? And so she's going to show a bridge, and what you're doing is the shoulders and the feet are the only two pieces touching the ground. Slowly raising your rear up off of the ground, holding the pelvic girdle in space, and then relaxing and bring it down. This really is a very fundamentally sound rehabilitative exercise that really can help in that area of concern in the sacral and pelvic area associated with the conditions we've talked about. So I'm going to have you turn over onto your stomach, please. Now, she's going to do what is called a cobra pose, which is an extension. Okay? So scoot this way just a little bit. Okay. Now, just arch yourself back, and what she's doing is she's arching her back, and she is accentuating this extended position. We spend so much time bent over, sitting down, that this is a very limited motion. So we do that and come out and relax down. And then come back up. And you would repeat this 3 times, holding each one for about a count of 3. From here, you'll come up onto your knees. Now, because of her hip issue, she's not able to get into a full child's pose, which is where she would rock herself back onto her knees. So the modification would be with the chair, back like this. Okay. Now, when you're in this knee position, we're going to do what is called the cat and the camel. Okay, and what we're doing, you're arching the back up. Okay, and then you let the back sag down in between, and so you're curving it up this way, and then sagging it back down in between. And now this is very key for helping these individual segments start to mobilize on their own. Okay, we did that one. Okay, now do the opposite leg, opposite arm. Okay, so she's going to do opposite leg, opposite arm, and this does cross patterning contraction, which is critical in motion. So when we ambulate ourselves forward, the pelvis and the shoulders have to work in opposition to each other. There you go. There you go. And you have to think, this challenges the brain too.
Yes, thank you.
And so this helps this cross patterning, which helps in all ambulation and all movement. Then plus she's strengthening. That's okay. Relax. Relax. Okay, and now we'll do Joan's favorite. Okay, this is called a plank, and a plank is she's going to support herself only on the elbows and the toes. So she will lift up her body and hold herself in this position. This makes all the intrinsic muscles of the spine and the abdominal wall hold herself in space. And so it allows for this area of the body then to be to be contracted and activated in a way it normally does not happen. And so this is a very good neurological challenge for, for it, as well as the exercise part as well. And then the last thing we would want to do, particularly with the sciatic and restless leg part, is we want to stretch out the muscles of the leg. So come up on your knees. And we didn't talk about this one. So I'm throwing her a curve a little bit, and just put one knee out in front of the other like I am.
And holding on to something.
Yeah. Okay. And so bring this leg forward, and just rock yourself, the whole body forward, and stretch out this hip flexor.
Oh.
Okay. And so by coming forward, you're lengthening out the hip flexor muscle here, and then you rock yourself backwards, and you stretch out the hamstring behind. Okay. Okay. There you go. There you go. I threw this one in on her. So.
I haven't had this one yet.
But we do need to lengthen the hamstrings. And okay, go ahead and come on up, and you can have a seat right there. And a modification to that would be just to do a hamstring stretch like this over a chair. It's always good to support the weight of the torso. It allows you to stretch deeper into the muscle than you will otherwise. And then to do the hip flexors, you just take one leg back and rock your hips forward. Okay? So we've talked about restless leg syndrome. We've talked about sciatica. We've heard a wonderful story by Joan about how she has dealt with this very successfully. On future episodes, we're looking to talk about migraine headaches, shoulder issues, rotator cuff issues, and we are trying to bring a better light to what health conditions people are dealing with, and a deeper understanding as to how people are meeting these challenges and successfully living a better life. I'm Dr. Philip Corbin. We have a Back to Health class, 8 a.m. on Tuesday mornings at Reardon Hall, free to POA members. And we are also have upcoming shows, and we would love to have questions and information about what you would like for us to cover. So thank you, and we'll see you next time.